Hundreds of thousands of babies are born prematurely every year, but a new report card has given the U.S. a poor grade. Our Stacey Skryzak has more on how our state was graded and why some healthcare professionals are now concerned.
The March of Dimes gives a grade to each state when it comes to the health of babies and moms, and it turns out there's a lot of work that needs to be done. A new report shows a troubling trend.
The March of Dimes puts out grades, and really the country is in a really bad position at a D+, and that is really, where we sit and the landscape is.
And it's not any better on a local level. Illinois receiving the same grade as the country in March of Dimes' annual report on preterm birth rates.
A D+ is never a good grade, and the way I look at it is a way for us as a state to improve the care of our patients and decrease preterm delivery.
So what's behind the high rate? Dr. Elizabeth Chereau with March of Dimes says one reason is the lack of prenatal care in areas known as maternal care deserts.
We know that that increases inadequate prenatal care. We know that chronic conditions are higher in those places, and all of that contributes to the worsening outcomes that are happening for moms.
Here in Illinois, there are other disparities that also factor in.
So one is socioeconomic. We have an increased drug use, especially methamphetamine, and that clearly increases the risk for preterm delivery.
As states use this report card to look at ways to make positive changes, Dr. Robert Abrams says it comes down to access for patients.
We need to find a way via telemedicine or these mobile units where we actually, as providers, whether you're a nurse midwife, a nurse practitioner, a physician, we need to all team up together and reach out to our patients to make prenatal care more accessible for them.
And a healthy mom leads to a better chance of a healthy baby.
We need as a country to really focus here and realize moms make most of the decisions for families, and realizing that if we don't support them, then we're not supporting the whole family.
Another takeaway from this report card, the need to establish prenatal care before you get pregnant. Both doctors say chronic conditions like diabetes, obesity, and hypertension can all lead to premature birth.
Thank you, Stacey. You can find the full March of Dimes report over on our website, foxillinois.com.